Hi, everyone. I am Jenny Douglas, and I'd love to welcome you to Raging Gracefully, the official podcast of Revel, a community and events platform for women in midlife and beyond who are reimagining the possibilities as we age, and for which I serve as Revel's hosting director, which I love to do. And as part of that, I'm very happy today to introduce and welcome Celeste Compton, who's the clinical content lead with Origin, a women's health startup that caters exclusively to our needs around the pelvic floor. So in the spirit of there's no such thing as a dumb question, Celeste, I just want to say to you, like, I'm almost 59 years old, and I am not embarrassed to say, I don't even know where the heck my pelvic floor is. I'm guessing it has to do somewhere, it's in the vicinity of my vagina, but I literally, I'm very happy to have this opportunity to be in conversation with you because I need the scoop. It's nothing that I grew up learning anything about. So would love to have you teach us. So
I would love to share.
What the heck is the pelvic floor?
That sounds good. Well, let's start there. For what it's worth, I feel like none of us got this education. I think about my health class and I don't know what I learned in it, but it definitely wasn't anything relevant to me and my body. And it would have been nice to know what the pelvic floor is, what its function was, what it looks like if it's not working well, so we know what normal looks like and what not normal is. Because that's something that, again, we don't talk about this area, we don't consider it like in our control. So it becomes one of those things that like, we just, I don't know, keep it to ourselves. But I have a visual. I find it very helpful to start with. So this is the pelvis.
Oh, look at that.
The red, that's the pelvic floor. So the pelvic floor is a collection of muscles at the base of the pelvis. It circles from the pubic bone to sit bones to tailbones all around. And it obviously encompasses the anal opening, vaginal opening, urethral opening. But as you can see, it's just a bowl of muscle at the base of the pelvis. So it's pretty unique in that way.
Fascinating. And I know for those of you who are listening and can't see us, Celeste is holding up this fantastic, it's like
model,
a part of a skeleton that would just be the pelvis, basically, with the muscle attached, showing in a very visually super helpful way what the pelvic floor actually is.
Yeah, it's bright red and it literally just goes everywhere from the base of your pubic bone, like feel between your sit bones, feel your tailbone, everywhere in between that. That's all muscle. It's all your pelvic floor.
I love that. So what is the importance, Celeste, of the pelvic floor?
Well, if you can imagine, because of its location, it has a lot of different jobs. In reality, it's muscle. So muscles do two things. They either contract or they relax. Like that's a muscle's function. But because of the location of this muscle group specifically, when they contract, they hold in your pee, they hold in your gas and bowel movements, they hold up your internal organs, like your bladder is just in that position, your uterus is there, your rectum, and they work to stabilize the joints of your pelvis. So that includes the pubic joint in the front and the joints in the back where the SI joints meet. So, and also the tailbone coccyx, that joint. So anyway, they work to contract and help in all of those functions. They also work in relaxation. And when they relax, that's how you deliver a baby. That's how you insert a diva cup or a tampon. That's how you engage in penetrative sex. That's how you pass a bowel movement. That's how you effectively pee. So equally important is those muscles' ability to contract well and relax well. And that's their main function. And so when there's a dysfunction in these muscles, it can lead to dysfunction in sexual, bladder, or bowel movement function. So that's the value and relevance of this muscle group. And that's what we work on. It's just helping reduce.
So helpful. I have to say, I'm so glad that I can now, I have to thank you for that visual. It was super helpful.
Sure.
And now when people talk about the pelvic floor, I don't have to kind of look out the window in a mild panic.
Yeah.
What we're talking about. So let me ask you, I mean, I can kind of imagine, but it would be really helpful for you to kind of confirm. It seems like I'm hearing more about pelvic floor because I myself, I'm a woman who's getting older, or pelvic floor as an idea has come more into the vernacular. It could be a little bit of both in the past 20 years or 15 years. So what is, I guess I want to ask a little about that. And I want to ask you about why is a pelvic floor, the idea of pelvic floor and maybe what we can do to, I mean, how do we Here's one question. How can we tell that our pelvic floor might need attention in a way that it might not have in our 20s?
Right. That's, I would say the first signal that something might not be working well is a sign of some sort of dysfunction outside of the range of normal. So I think it's helpful just to know what normal is. What's normal peeing habits? What's normal bowel movements? What's normal with sexual function? And then you can kind of assess yourself like, oh, is this normal? And then you can start to question like, okay, that's not what I do. Have I ever been normal? You know, is this something that my normal has not been normal, but I didn't know that because nobody shares this, nobody talks about it.
Right.
So I find that's the most helpful way to kind of self-assess of what your body's function is. It's the same with any muscle group. Like if suddenly you're trying to go for a walk and you start to notice pain in your knee and you're like, oh, what's going, or my hip, my low back, like you start to assess things based on how well you can function. And so it's the same with this muscle group. So in this area, the main ways that you can tell what's normal, what's not, let's start with peeing. So normal is you should be able to hold your pee while drinking 8 glasses of water a day, 3 to 5 hours at a time. As we age, that might lessen a little bit to maybe 2 to 4 hours, but still being able to hold it. It's not that you necessarily have to hold it all the time, but you have that ability to do so. Obviously, drinking more water would make that more on the frequent side versus the 5-hour stints. But the bladder is built for storage. And so having the ability to store is important. When you do pee, you should be able to make it to the restroom in time, no leaking before or at any other points throughout the day. Sit on the toilet and void. It should be a strong, steady stream. It shouldn't be this like hesitation of like start, stop, shy bladder kind of situation, or stopping prematurely or like dribbling to one side. It should be a strong, steady stream without the need to push. It should just like gravity helps pull it out, you know? That's what normal, for at least 8 seconds. If you're peeing strong, steady stream and it's like 2 seconds, probably didn't need to pee. It wasn't exactly the right time. And you might have been doing it just in case, because you're about to, you know, hit the road or go to grocery shopping or go pick somebody up from the airport. And you're like, let me just use the bathroom now. And so suddenly that is something that can develop innocently of like, I'm just this one time, I just need to go before I go. But can quickly turn into a habit where it's like, oh, actually I'm peeing a lot more frequently than I used to. And it just kind of slipped into that, especially with COVID. I just have a bathroom right there. So I just go whenever I need to go. And that 3 to 5 hours is like an impossible idea. Or you don't even realize you're not doing that. You think I'm just going normally, but it's like every 30 minutes.
Right.
So that's peeing habits.
Yeah.
Bowel movements. You should be able to have a bowel movement. Normal range is 3 times a day to every 3 days. If you're outside of that range, something might be slightly off with your GI tract or your pelvic floor function. So ideally daily bowel movements with a good consistency. And I show people a little stool chart to show like what the consistency is ideally, but basically for those who are just listening, it's supposed to be like kind of a firm, but solid, but also soft. So it's not like you have a bowel movement, it just dissolves in the toilet. That's not what you're looking for. Looking for it to be soft. You're not needing to strain to have a bowel movement. There's maybe like, you know, gentle pushing to help get it along, but for the most part,
a sense of what that, what normal might.
Everybody knows what a good bowel movement feels like and looks like.
Right.
And then sexual function is basically the biggest thing is it shouldn't be painful. Like for anybody who feels pain at any point during intercourse, there might be something going on with the pelvic floor muscles themselves. There might be something going on with the tissue that surrounds the vaginal opening or the vaginal canal. And there's a lot of things that can kind of contribute towards sexual dysfunction. And also, we all know sex is loaded. It's not just the physical. There's so many other elements that tie into it that might change our interest in having sex, our ability to tolerate or libido, things like that. So so basically those are the basic things to know for sure. So shouldn't be leaking,
peeing, pooping, and
pain-free sex. Yeah. And if those are going well, probably you're fine.
Right.
But I think it's just worth it to maybe also consider assessing them more closely, just to know exactly how fine am I? Am I like on the verge of like not fine?
Right.
Am I just getting by with my lifestyle? But then as soon as I retire and I'm not on my feet as much anymore and I'm not doing as many things, like, does that affect my pelvic floor? And suddenly now I'm leaking suddenly and I didn't have this issue ever before.
Right.
So I think it's never a bad idea to know more in depth what your body is actually capable of. But
So helpful. So helpful.
yeah,
So if you're just joining us now, I'm very happy to be in conversation with Celeste Compton, who's the clinical content lead with Origin, a women's health startup that caters exclusively to our needs, women's needs around the pelvic floor. And Celeste is very helpfully explaining what the pelvic floor actually is and how we can be made aware when our pelvic floor might need attention in a way that maybe women of 20 and 30 years ago didn't even think to ask, because these tools that Celeste and her company are making available to us might not have been as widely accessible. So we do have Celeste. Oh, and by the way, I'm Jenny Douglas. I'm Revel's hosting director. Very happy to be here in conversation with Celeste. So we have a couple of questions that have come in. Maybe I can just go ahead and put them out, and then as part of that, you can start to share with us how how virtual sessions around pelvic floor therapy even work. But let's start. We have one of our revelers whose question is, I'm 3 months post total hysterectomy. Is there anything extra I should be doing?
I think yes. I think it's always so bizarre how many surgeries they offer for women and people with vaginal anatomy that don't involve physical therapy afterwards. How many male surgeries exist where they're like, oh, now go see a physical therapist because you just had a rotator cuff repair, or you just, I mean, anything, or prostate removed. There's so many things that I just think it's so bizarre that the number of people I've met who've had hysterectomies or surgeries related to ovary, uterus, fallopian tubes, all that, or even fibroid removal. Cesarean delivery is a perfect example. There's no consideration of like, okay, now go be free, go just rest, take it easy, whatever that means. But I usually recommend, especially with a change like that, because with a hysterectomy, don't even if they have the ovaries in place or not, it can change your hormones pretty immediately. And that can have an impact on your pelvic floor that can feel pretty dramatic. So I think it's always a good idea. I'm biased, but I feel like the more you know about your body and what it's doing, and the fact that your pelvic floor does so much to help support those parts of your body. Your pelvic floor is just in that area where the surgery takes place. Our muscles are very reactionary to any type of trauma or experience. And so sometimes even just something as simple as a surgery might be enough for those muscles to start to dysfunction because of the, maybe they're guarding after a surgery or that experience. And maybe that might impact their ability to contract and relax effectively. So yeah, I typically recommend one strategy is to maybe just take a moment for yourself and see like, okay, how are my pelvic floor muscles feeling? Can I squeeze them when I want to? Can I relax them when I want to? Do they feel different? Do things feel different? Do I feel more heaviness? Do I feel less heaviness? Do I feel like I'm leaking a little bit more frequently, or not leaking at all and I used to? Like what types of changes are you experiencing? Either way, I really highly recommend meeting with somebody and just helping them talk you through it and be like, okay, here's where you are now post hysterectomy. And then you can have a baseline for where you might be 10 years from now. And you can always look back to it and be like, okay, where am I now compared to then? Do I need to do anything to maintain? Am I losing? Am I changing? What's going on? So I mean, again, I know I'm biased, but I recommend even my patients who are in their 20s and have endometriosis and have surgery for that. I'm like, it doesn't hurt to just make sure that your whole body comes out of surgery doing well, and not just the parts that you can see.
Super helpful. Now, I mean, I have a question of my own, because you talked about one's body, like the trauma can definitely impact pelvic floor. And here's an obvious trauma, although of course I didn't imagine it as trauma at the time because there was such a good result out of it, but childbirth. And I know for myself, like my younger daughter is 24 years old, but I have to say, as you've been talking about the pelvic floor and how it can be impacted, I look back now and I think my pelvic floor was super impacted by the birth of my kids, particularly my second child. And I just sort of feel like everything kind of like, I don't know, like gravity, I don't know if it's gravity or something, but everything sort of felt that like I can just even feel stuff down there that didn't used to be there.
Yeah. And that's very common. And delivery is a trauma. Obviously it's a positive result. Obviously it's, for many people, not always, but it's a trauma. Trauma is anything that can trigger The biggest issue with trauma is your muscles react to the same way any other, like your pelvic floor reacts the same way as any other muscle group in your body. If you have a car accident and you have whiplash in your neck, your muscles react by just guarding, which is why muscle relaxers are so helpful. It just things just kind of relax and calm back down. The same result can happen postpartum, where you have this delivery, maybe there's a tear involved, maybe there's a episiotomy involved, and there's actual healing that needs to place afterwards. And that trauma can cause those muscles to do that same kind of guarding. And so a lot of people will experience after delivery, they'll have pain with sex all of a sudden. And like, why is this going on? What's happening? And the problem with muscle guarding in other, if our neck guards, if we start to clench our jaw, we're just like this, eventually we look in the mirror and we're like, oh, hold on, let me just drop this and like relax this. The pelvic floor is this area that we're first not even told is muscle. So we don't even know that it's in our control or something we can do something about. And then secondly, we don't see it. So it's out of sight, out of mind. And so a tight pelvic floor muscle can be tight and stay tight for years. Like it's not something that just like, you know, that trauma's behind me. You still have the same pelvic floor and the same body that you had when you delivered your baby 24 years ago.
That makes so much sense. What about, if I may ask, I've heard, and I don't know if this is a misconception or not that you can clear up, that too many Kegel exercises can, that you can over Kegelize. Is that
true? It's true. And it's basically, it's not so much that if I told you that you, like a bicep curl looks like this, relax, contract, all the way down. A Kegel should look the same. You should be contracting the muscles and then relaxing it all the way back down. Contract and relax. The problem with Kegels when they are done incorrectly, and often it's not even intentional, it's just depending on where you're starting from, changes the effectiveness of the contraction. If your pelvic floor muscles have been guarding and they're like this for 9 months of pregnancy, and then after delivery, they're still here, a contraction might look like this. And so a Kegel feels the same to somebody like, oh, I'm going all the way up, all the way down. This is what I'm doing. But they have no concept of the range they're working with is so severely limited that their effectiveness of the contraction, their effectiveness of relaxation, all of it is compromised. And so that's when doing Kegels is not helpful. And it's imagine if I had a weight in my hand, I was doing bicep curls like this at the gym, people would be like, that person's crazy, you know? So it's the same principle. You need the range of motion in order to make sure that when you're building strength, when you're doing a Kegel, you're doing it effectively. And then once you have that range, once you're confident in that and you know your body and you have the range that you need, you're not leaking when you're coughing or sneezing, you're not leaking on the way to the bathroom, you're able to hold in gas when you need to, you don't feel that heaviness at the vagina when you're walking or doing things. When you have that function, then you can do as many Kegels as you want. You know, you could do like this every day, all day. You know, it's not problematic. It's the same thing with bicep curls. I'm just doing this all day. Like, I'm not going to do anything. I'm not hurting myself. Maybe it's not useful functionally, like for me to be able to do that 100 times a day, but it's not problematic.
A related question, and then there's another question by Madeline, and then I want to talk about what it is that what virtual pelvic floor therapy can do, which I know is really important. But Deanne asks, using inserted Kegel balls, good or bad?
It depends on your starting position again. If you're starting here and then you insert one of those weights, then first of all, it's super easy to hold that in place, right? Like you have to like kind of squeeze it past the muscle layer and it's just sitting there. So the time that I use weights is when people have a hard time tapping into their pelvic floor and their muscles are weak. So the weights are helpful, they're useful, but it's not one of those things where you should put in a Yoni egg and just walk around for 12 hours and just be like, this is my day now. And my pelvic floor is getting stronger just because something's there. I can tell you, if you have like a 2 pound or a 15 kilogram or whatever you got in your vagina, your pelvic floor is doing much more work just by stabilizing your pelvis with exercise. Just walking around, your pelvic floor has to contract to stabilize those joints. So it's already turning on and contracting. And that extra weight might not be doing anything. Once I compare it to like, you know, when you like sprain an ankle in the very beginning, your exercises are like, oh, my toes are going down and up. This is my exercise. And then I have a band and I'm just like, okay, I'm working through it. And then eventually you start to walk on the foot, you put a little bit more weight into it. And it starts to, eventually you just walk normally and it heals. At that point, it would be silly to do this, you know? So that's kind of how I treat the weights as well. Like at a certain point, the weights are really valuable for giving you feedback, for giving you awareness of those muscles and making sure they're turning on when you want them to, when you're asking them to, and that they're effective at that. But at a certain point, if you're just able to hold it in place all day and walk around the house and, do laundry or, answer emails, you could do that without it in place, and it's fine, and it's not doing anything for you. But what so that's my thought on the weights is typically it's like there's a place for it. It is very useful, very valuable for building up. But once you get to a certain point, you don't need it. Your body's going to, if you maintain a certain level of activity, you're going to maintain that muscle function.
That's helpful. And listen, you mentioned it, not me, but when you mentioned the Yoni egg, I've got to follow up and ask, there's been so much conversation, a certain amount of mocking of the idea that where do you fall on the Yoni egg?
I'm always looking for evidence-based research. If there's research behind it and it shows that it does X, Y, and Z that it says it's supposed to do, then I will quickly change my tune and be like, okay, let's all buy one. But right now, I just don't see it. I don't see that research. I don't see the benefits. I don't see it being more useful than X, Y, and Z, than just doing a Kegel, than just having sex. Just like certain things that should bring blood flow to the area and help activate muscles. So that's I'm not going to talk negatively on anything, because placebo works. If somebody has a Yoni egg and it helps them, I'm not going to talk them out of that. Then good for them. I'm glad you found the thing that works for you. And there's nothing wrong with that.
That seems very reasoned. Now, I do want to ask we have another question. I just want to ask that because it's kind of in the whole bailiwick of identifying what might need attention, and then we can get to the actual therapy involved around pelvic floor issues. We have a Reveler here who says, I'm not normal because my bladder is tipped. What do you think about that? Because I've heard that lots of bladders are tipped, and that doesn't necessarily mean abnormal. But what is
I've heard the same. Bladder positioning, uterine, like your uterus positioning, like your cervix position, all these things do have an impact. However, there's definitely, the goal with physical therapy is, okay, what are you coming to the table with? What are your symptoms? What are your difficulties? What's the trouble? When people have a tipped bladder, they're like, oh, well, I leak because of this. And I'm always very cautious to everybody's body is different. And there are definitely elements that make someone more prone to dysfunction than someone else. But we are the controllers of our bodies. And it's never a bad idea to see, okay, I understand that I have this extra thing that makes it a little bit harder for me than for other people. Functionally, that means that I might not be able to hold and pee as long as somebody else, or I leak on my way to the bathroom, or I leak when I cough or sneeze 3 times in a row. What's great about the pelvic floor is if you need more from those muscles, if you need them to function better, you can make them do that. You can get them stronger. You can rebuild them to make up for this dysfunction. Like in the same way I have patients who've had like 4th degree tears during delivery. They suddenly have less actual muscle fibers because scar tissue is replacing that area, but the muscles that remain can compensate. They can make up the difference. And so in the same way, when people do have these other issues, it's like, okay, well, how do we address what's the function that's problematic for you? What can we do to improve that? And sometimes it's a matter of like, maybe a pessary is part of the solution. Maybe just building strength in your muscles is part of the solution. Maybe it's a combination of different things. Maybe if it's so severe, some people, their doctors will recommend surgical intervention, and that's their only solution. So there are so many different avenues, but I'm always one that's like, try the least invasive first. Know your body, make sure your muscles are working well. If your muscles are doing all that they can and they're as good as they're going to be, then you can feel confident in, okay, I understand my limitations. I understand where I am right now. I'm happy with this, or I'm not, and I want to keep looking for other solutions, whether it's surgical, pharmaceutical, pessary, different kind of interventions. But
it feels so sound and so helpful, Celeste, I must say. And since we're already sort of moving into talking about what therapy might look like, I'd love to have you share with the Revel community a little more about what Origin specifically does and what pelvic floor therapy, virtual pelvic floor therapy looks like. How do you assess a new client coming in, and how do you prescribe, and how do you engage? We'd love to know,
Yeah.
how might we seek you out for what, and what might that look like?
So maybe I'll start with just in person first, because that's a little bit more typical of what you'd expect. In person, when you go to a physical therapist for pelvic floor physical therapy, you meet your therapist. They'll ask you a million questions about the things I described: sexual, bladder, bowel movement, activity level, symptoms, all of your function, and just get an idea to get a big picture of what's going on. At that point, I can tell you that your therapist already has an idea of what they're expecting to find on the evaluation. They're already kind of like, okay, based on what you're describing, it sounds like X, Y, and Z is happening. But then the evaluation is to confirm that. So the evaluation typically looks like you undress from the waist down. Your therapist, completely with consent, always asks like, okay, at this point, we want to start externally and take a look at what your tissue looks like, at what your coordination looks like without me even touching anything, just so I can see what's going on. And then they'll, gloved, lubricated, insert one finger with your permission and ask you to squeeze, ask you to release, ask you to push like you're trying to pass a bowel movement. They'll ask you to see what your endurance is like, what your strength is like, and then they'll try to palpate and see if any of the muscles or tissue feels different. Like if one side feels like, oh, it feels sore or bruised or sharp, and this side feels not. And so then they're getting an assessment of what muscles might be involved in the dysfunction, and how do we then work on addressing that. So in person, they might do a combination of manual release of muscles and biofeedback, which involves either mirrors or using the finger, just like some sort of feedback mechanism, so that you can understand when you turn them on and off, and you have feedback to give you that idea of what's happening. There's sometimes even just like electrodes I can put on to see if that's a better way for you to receive biofeedback. And then at the end, once they have that information, then it's like, okay, here's the program. Here's how we're going to work on improving this. So take all of that and take it virtually. The only thing I can't do is that part where I see you in person. I don't get to see your vulva, your vagina, your pelvic floor muscles. I don't get to feel them. I love virtual and I love this population because everyone is no nonsense. Everyone's like, I just need to know what I need to do. Like, I'm not trying to come here and get a massage in my vagina. Like, that's not what I'm here for. I just want to get better, and versus like other populations where that's not always the case. And I really love working with this age group, this population, because there is this like this I want to get better. How do I do that? And virtually, what I love about virtual is it's this teach a woman to fish type of a thing versus like, come in and I'll tell you what's going on. And it becomes a partnership where I express to them like, okay, here I do the interview, we do all of that, we talk through it, and then I provide like, okay, here's a pelvic floor self-assessment packet. I want you to try and do as much of this as you can, and then bring it back and we're going to talk through it. I already have an idea of what I think is going on, but I just want to see if you can kind of understand and start to find what I'm seeing, so that we're on the same page. And then it becomes developing a program together where it's like, okay, here's our findings, here's what's working, here's what's not. Let's try this avenue. And then if we hit a roadblock, we could try something else. And if we hit another roadblock and it's like, you know what, I'm just not getting it. I'm the first person who's like, you know what, let's get you in person. Because even if it's not with Origin, if there's somebody in your neighborhood who does this, reach out to your OB and see if there's somebody who accepts insurance, who can do pelvic floor assessments. But that's usually the strategy. And I've had a lot of success with that. And I really enjoy that.
So am I right in thinking that with any new client, you have the expectation that you will probably see her more than once, that there will be a few sessions, and then if you are on a course that she'll check in with you, or you'll check in with each other with, I don't know what,
it's the frequency depends on, it's so much of it is just like, okay, what's your schedule like? I know that most people have lives and things to do. So it's what works for you. For some people, they're just like, I can't do this every week because I just would feel guilty about not actually doing it before I see you next. So sometimes I'll see people once every 2 weeks for like the course of, 3 months or 4 months, or, depending on like how frequently and how their symptoms are responding and what their goals are. Because some people will come and they're like, you know what, I only have this one issue and it's just leaking. And then like fast forward 5 sessions and like, actually, now you mentioned my hip has been killing me for 5 years, and it becomes this like, and it's all so tied together. Your body works together. If your pelvis is trying to be stabilized by your pelvic floor and it's not working well, chances are another muscle is taking up the slack. And so there can be a domino effect of these other issues that surface. And so I'm happy to talk through any and all of them. But I have some patients where it's like I see them 3 times or 2 times or 1 time, and they're like, oh, I'm good. I get it. I could do this. And it's kind of changes per person.
So cool. And I've been loving just personally, like, the advantages of telehealth for women in our population.
Right.
But I think also, like, I just wonder, as you were speaking, that like having the mediation of a computer screen, which can sometimes be distancing, also might afford some of your clients to be maybe a little more forthcoming.
Yes.
Because you're in your own home. And I don't know, that I can imagine that there might be some, unexpected advantages of seeing some of your clients.
Absolutely. Absolutely. Yeah. I think the idea of going in person and having a stranger put their finger in your vagina, what I see frequently in that scenario is people back off. They like almost like at the OB where people just like, okay, I'm just gonna be in my own world, you do you, and you kind of like check out of the event, of the experience. And when you're actually doing a session in person, that's problematic because the whole goal of the session is for you to check in and be present. And if it's difficult to do that, for a lot of people it is, it's so beneficial to have this. Sometimes the barrier does make it easier and make it more approachable and more like, oh, I'm not going to ignore this, because there's not so many barriers to actually addressing it, as opposed to like getting an appointment, finding a clinic, going in person and just being embarrassed to talk to this person about what's going on.
Of course. So tell me a little bit more. I'm just trying to figure out, like, how many, if someone wants to reach out to you or to Origin, they log on, and I guess, is there a website that you can?
I think it's in the chat right now. I think somebody just added it there, Sydney. Thank you. And it's the originway.com. There's so much information there. There's blog content. There's you can see where our in-person locations are. Currently, we're just located in person in California and Texas, but that's something that we're really working to try to expand and grow our reach. And virtually probably will be expanding first, realistically, just because it's easier than opening a clinic. And but it's not as easy as I'd like, because we're still not in all 50 states yet, but we're working on it. And in the meantime, we do offer coaching for other locations that's not as physical therapy involved, but it kind of it touches into it. It just can't be as as thorough as doing an in-person assessment or a virtual physical therapy assessment, but it's available, and sometimes that's all you need. But it's something that we're working on.
Is your way of working getting any kind of pushback from like conventional gynecologists who I'm curious about that, because I feel like it's fantastic, but I wonder if there are some gynecologists who somehow think that anything that is telehealth related might be
not as good
or threatening their base or any of that.
Yeah, I've definitely had a mixture of responses. I've had some OBs who are like, oh, this is great. My patients can just actually see you. And then I have some OBs who are like, no, you need to go in person. This isn't going to be enough for you. Your situation demands in person. And I'm not going to argue with the provider. But if I could, I would. I'd say that it's fine. It's, what's the harm in trying? And if it's not successful, like, this person hasn't seen a physical therapist in 5 decades.
Absolutely.
Like, what's another 2 days going to cost them?
Can you disagree against a backdrop of women in midlife? Any of us who read the news know that women in midlife, that our bodies have not been studied and haven't been addressed with care and attention in the way that men's have. Yep. And so, I am, like, I say a big fat yes to any new initiative that really is seeking to, with care and leisure and real attention, give us our due and ask questions and be curious and help us.
Yep. And we're evidence-based also. We're not just pulling this out of thin air. We have research that we're following and guidelines. So we're really trying to show even like just the whole medical community and everybody that this works. It's not just
I love it. We should wrap up in the next couple of minutes, Celeste, but I did want to ask, is there like, can you pull off the top of your head kind of a success story of someone who came to you, who maybe was unsure, and what Origin was able to do for her?
Yeah, I mean, I can say that I've worked with patients ages, 17 to 78. I've seen so many different various conditions, presentations, like issues, functional problems. And so it's hard to just name one, but I would say that generally nothing bad comes from knowing more about your body.
Yeah.
And so I would say that at the worst, people walk away knowing about their pelvic floor. They walk away knowing about their condition and what's going on in their body. And sometimes that is enough for them to feel supported and be able to live their life and feel confident in what they're doing. And it's a lot. It's a lot for people to come to physical therapy for the pelvic floor, because for so many people, it's been an area that we've been trained to ignore our whole life. If you have your period, don't talk about it. If you, smile and put on a,
Or
pretend like
even
it's
worse,
nothing.
like feel ashamed or embarrassed about, right?
Right. So there's such a hurdle to address just the negativity that's been just in this whole region for so many generations. And I really, whenever I see people who are in their 70s, who are, in their 60s, in their 80s, I'm always just so impressed, because I know that's so hard to do, to come and see somebody, to seek help, because their whole life they've been learning how to just deal. Like it's like, I can survive. Survival mode is their baseline. And getting beyond that can be challenging, because it's sometimes scary to hear that you can do something about it, because it makes you feel like, okay, well, am I a bad person for not having done something yet? And there's just so many things. It's so loaded.
So nuanced. It's really nuanced.
I'm sorry I can't give one example, but I just want to say that there's so many range, and
100%.
it's all relevant.
We do have a Reveler, a late breaking question from a Reveler who is on your website now, Celeste. And she says, I'm on the website now. Can you only do virtual meetings in California, Texas, and New York?
No, you can do virtual if the question is, yes, you can only do virtual if you are located in California, Texas, New York. You can do in person in California or Texas. And we are trying really hard to expand the states that we can offer virtual and in person in the next year. We're trying really hard to expand it. But right now, the only locations that we can treat you virtually is if you are located in California, New York, or Texas.
Treat virtually or treat in person?
Virtually.
Okay. Well, that's good to know.
Yeah.
You're working hard. It sounds like
we're trying to expand it. I know I'm from New Jersey, and so I'm just like, come on, we need to help everybody.
And what are the impediments? We do have to wrap up, but what are the impediments?
Insurance. We want to always be able to accept insurance and be able to help people with that, because cash-based is so unaffordable and so out of reach. Like, I can guarantee you right now, if you're in a certain state, you can look up a cash-based provider and you can get a pelvic floor physical therapy assessment. It exists, but we're just trying really hard to make sure this is something that everybody can access through their health insurance.
Now? Do you take insurance?
Yep. If you're in California, Texas, New York, we accept most insurances. You could check with our website and see which one specifically, if yours falls into that. But okay. As soon as we can get insurance to catch up, we're gonna open up in more places.
This has been super helpful. So grateful for this conversation with you. Celeste Compton, clinical content lead with Origin, a women's health startup that caters exclusively to our needs around the pelvic floor. The website, again, is the www.theoriginway.com. That's how you reach Michelle or Celeste company, Origin, for all kinds of questions about the pelvic floor. And if you might be interested in the possibility of engaging in virtual pelvic floor therapy, that would be the website to check out. Celeste, this has been fantastic. Thank you so much. I feel like I know a lot more than I did 40 minutes ago.
Happy to be here. Thank you so much.
Take good care. I'm Jenny Douglas, Revel's hosting director. This is Raging Gracefully. See you next time.